this is on. Good afternoon, everyone. Welcome to hashtag Nurses for Hope, and thank you for joining our live discussion. I wanted to introduce myself. My name is Leilani Pataxel. I'm one of the nurse recruiters here at City of Hope. City of Hope is a research and treatment center for cancer, diabetes, and other life-threatening diseases. We are designated as a comprehensive cancer center, and we're a founding member of the National Comprehensive Cancer Network. We are situated on a park-like campus that is 100 acres, and it's located northeast of Los Angeles, and we have 5,000 plus employees. I would like to introduce our panelists, Bonnie, who is from the Clinical Supportive Care Department, Mary from BMT, the 6th Floor Helford Clinical Research Hospital, Jason Tabor, who is from the Day Hospital and the Vascular Access Department, and Jennifer from the Professional Education Practice and Education Department. And also Kayla Hernandez, who is one of our nurse recruiters here in Human Resources. So, panelists, please say hello to the audience.
Hello.
Hello.
Okay.
Before we get started on our discussion, a couple things we want to share. If you're watching us on Google+, you can submit your questions through question and answer app. If you're viewing the broadcast from your YouTube, annotations are available on the video. The annotations will point you to the Hangout on Air page with the Q&A app. Also joining our discussion on Twitter. Make sure to add hashtag Nurses for Hope to your tweets and questions.
So let's begin. I would like to have the panelists introduce themselves and state where they currently work and how long they've been here at City of Hope.
Hi, my name is Bonnie Freeman. I am a nurse practitioner. I work in supportive care medicine. Primarily my focus is pain management. Supportive care is really just that. We are available to help physicians, to help staff, to help patients and their families deal with any of the side effects related to treatment, all the way down to what issues they're dealing with emotionally. So I've been here at City Hope for almost 5 years.
Thank you, Bonnie.
Mm-hmm.
So I take it it's my turn. My name is Mary Colasano. I do practice up on the bone marrow transplant unit. I've been at City of Hope actually for, I want to say 17, 18 years. I think 18 years now. I was here for an 11-year period and left to be a stay-at-home mom for about 7 or 8 years. And then I've been back now for another 7 years. So I really have always enjoyed City of Hope, which hopefully comes through in this tweet chat. I am a charge nurse up on the unit. I also am on a couple committees. I serve as the chair on our professional practice and quality council. I am also on the magnet work team and newly part of the what's our new team called? I can't think of it. The one that we just started this week. Anyway, it's another committee. There's too many of them. What was I going to say? Anyway, I love it here, and I'm hoping that this shows everybody else, gives you some good insight into City of Hope and the practices.
Thank you, Mary.
Hi everyone, my name is Jason Tabor. I am the Assistant Clinical Nurse Manager in the Day Hospital and in the VAD Clinic. I've been at City of Hope for almost 3 years. I actually started at City of Hope as a bedside nurse in the ICU working night shift. And about a year after that, I became the Assistant Manager in the ICU. And then this last June, I became the Assistant Manager in the Day Hospital. The Day Hospital was started to be an outpatient clinic where patients could have outpatient transplants instead of having to be inpatient. So I've been there since June, and then for the last about 3 or 4 weeks, I've been the assistant manager in the VAD room. which is where patients go if they have a PICC line or if they have a portacath or they have a Hickman, some sort of essential access line. That's where they go for their blood draws. I am on a couple of committees myself. I'm on the magnet work team, which is a great work team as City of Hope is going towards magnet status, which is more about excellence in nursing care and excellence in our professional practice. And I'm also just started today, counsel myself, which is transitions of care, which is how we can improve how our patients go from clinic to clinic or from the clinic to the hospital or from our urgent care clinic, which is ETC, into inpatient, or from the hospital to going home. And I'm the chair-elect for that group. So welcome everyone, and hopefully we can share a lot of good ideas that will inspire you today.
Thank you, Jason.
Hi everybody, I'm Jenny Shamai and I'm one of the nurse educators in the Professional Practice and Education Department. We call them Professional Practice Leaders at City of Hope, and I'm one of them on the HEME and HCT service line. So that means that we educate and support nurses that take care of hematology and transplant patients. So that includes our 5th floor, 6th floor. Our patients actually go everywhere, so a lot of floors. So we interact with a lot of our nurses. And I have been at City of Hope in various roles for about 5 years. I started here as a research student and I did 3 summers as a research intern. And then I loved it here, so I came back here as a research associate for a full year as I was applying to nursing school with the intent of coming back to City of Hope as a nurse. So then I returned to the 6th floor and worked with Mary for a few years, and then recently joined about a year and a half ago the education department. I also sit on a few committees and councils, and I think it's a great opportunity for nurses to give their input and to really advance their own profession. And I'm on the magnet work team, and I'm also on the New Knowledge and Innovation Council. It's a very exciting time for nurses at City of Hope.
Great, thank you, Jen.
Thank you. Kayla Hernandez, I'm a baby. I've only been here 3 months, and I'm one of the clinical recruiters recruiting for the outpatient services.
Thank you, everyone. So the topics that we're going to discuss today is role-based practice, holistic nursing, and evidence-based practice. So I'm going to open up to the panel. What is role-based practice?
I think role-based practice is really seeing that nursing is a profession. It's not just a job that anyone can get, but you have to be trained in it. You have to go to school, work hard to get your degree, and then you have to test to get your license, which you have to renew regularly. And role-based practicing is really operating in the practice of nursing based on evidence and research, and not just coming in willy-nilly doing whatever you think is best, but really doing it from the stance of science and evidence that proves what we're doing is effective, and constantly learning. I think that's a big part of our profession, is constantly learning new ways, innovative ways to treat our patients, which we have a lot of success stories at City of Hope as how we are innovative in our research and in our treatment, and which draws a lot of people to come here for that, because we work as a profession and we're a strong, united forces nurses at City of Hope.
You know what, really piggybacking onto what Jason was just saying is, I want to say back in 2012, maybe 2011, 2012, we had Maria O'Rourke, who is one of the people who helped write the California Nurse Practice Act, come here and start teaching nurses. Of course, there's so many nurses here, she couldn't do all the teaching herself. So in 2013, 12 and 13, they took a group of us and taught us to teach her professional practice model. And some of the things that some of the different ways her theory is that really what Jason was saying is that really as a professional here at City of Hope, number one, in nursing, we need to first be a professional. Number two is secondarily comes the fact that we're nurses, but we are first and foremost a professional. And then thirdly is we practice in whatever clinical area that we choose. So part of that is being a scientist, a leader, a practitioner, and then lastly, and probably most important, is be a transfer of the information between departments, and also the transfer of knowledge between the doctors and the staff, and really a lot of what we're doing right now with the shared decision making at our hospital. Mm-hmm. I think we're sharing knowledge between multiple departments of nursing and bringing it together collectively for the best outcome of our patients.
I also think that role-based practice is really encouraging nurses to work up to their licensure, that there are certain tasks, and being a nurse practitioner, I can voice this, that I brought it to my administrators. I was spending a lot of time on the phone with insurance companies and not being able to be at the bedside. And they were really receptive to that, and recognized that they could hire an individual that could help free me up and now allow me to have more clinical time. And I think we as nurses are encouraged to be professionals and to really seek out those opportunities, and City of Hope has really come through to support that. And you're really always told, to share those ideas. And I think as nurses, it is a profession. It's not, and I know the way that I function because I'm probably the oldest one here. You are a part of a team, and your knowledge is important. And I think the only thing that holds you back here is yourself, because there's a lot of resources here that allow you to develop and grow, and they're very open to your ideas.
Now, since this was introduced to City of Hope, how does this impact the nurses on the unit? Or has there been an impact on the units since this was introduced?
I think one of the biggest things it does is it gives nurses a voice to be able to lead their profession and to be able to practice in the way that is best for our profession. And so I think that it has impacted our nurses. I think as we have started our shared governance, I think that that's really going to sort of change how nurses see their scope and realize that they do have a voice, they do have an impact, and it's important. And I think that a lot of them are starting to realize, oh, I do have a voice, it's important, I do have things that I can share, and not just share, but something's going to come, it's going to have an impact on our organization. And so I think that that's something that's really important. It's really exciting to see all of this come to fruition at City of Hope.
Now, I know you mentioned shared governance. Can you share exactly what that is to probably our potential nursing students, or even potential nurses that would like to consider City of Hope in the future?
So basically, when the three of us introduced ourselves, we all said that we're on work teams, and so work teams is a part of our shared governance. So basically, we have a model where you have your unit-based councils. Nurses can be involved in their own units at their unit level to solve problems. To bring in new, fresh ideas that can help better serve their patients. And then you have work teams that are also working on different things. If there are issues in the unit, infection rates are high, fall rates are high, that's the place where nurses could come in and say, well, what's the evidence? What are other organizations doing that's successful in bringing down the fall rates, for example? And then you have, so it's just a different structure of different councils that are nursing led, which is the important thing, is it's nursing led. It doesn't mean that everyone on the councils are nurses, because we also want it to be interprofessional, to where there's physicians, dietitians, therapy, PT, OT, all of these people involved that take care of the patients. But the exciting thing is it's driven by nurses, which really just encompasses, once again, going back to the profession. And so that's sort of, I guess, the structure. And it's sort of been a new process at City of Hope over the last couple of years, and we're still redefining it and retweaking it and improving it and sort of enlarging it, which can sometimes be overwhelming, but it's exciting because it gives even more voice to the nurses at the bedside, which is actually something I left out. The important part is that bedside nurses that are practicing, that are doing bedside care, have their voice. So it's not just managers, it's not just directors, but it's bedside nurses. That's really the heart of shared governance is to have bedside nurses who are doing the caring and the healing to be at the table to help bring solutions.
Great, thank you, Jason. So with the role-based practice, how does it impact patients?
You want to take this one, Jen? Or you want me to? I mean, I will, but Jen hasn't gotten a chance to voice it. Okay. I was just going to say, I think that it impacts our patients greatly, because really once nurses are aware that they have the autonomy that they have based on obviously our Nurse Practice Act and what it allows us to do, it gives us a little more I don't want to say courage, but it gives you a little more sense of ability of what you can do and how you can advocate for patients, and really the extent that you can. And then it also gives you a little more understanding of how you can delegate different responsibilities and also incorporate other disciplines into the work that you're doing. So ultimately, again, to have the best impact for those patients.
Anyone else would like to?
Well, what I see on the floor is when you see the fact that nurses are really empowered to be advocates of their patients, how readily they will come to you and, tell you my patient needs this, or this is what's going on. And they really take an active role in their care. And I will seek them out genuinely for their opinions, and I'll initiate things, and we really will work together to be sure that we provide really specific procedures, cares, treatment for that patient. And who better to know what that individual needs than the bedside nurse? And it's nice that they'll step up, and I don't have to seek them out. They'll usually come to me and say, he needs this more, he needs whatever, and we work together to try to make it happen. So I think that's a bigger change, in that they really recognize that role of advocate is huge, and it really helps to give their patient a voice and be sure they get the care that they need.
One of the nice things is that, and I was just talking to Bonnie about this prior to the start of our tweet chat, it does exactly what Bonnie says it does, because we have our staff meetings monthly, and we invite people to come and speak at them, and that gives us a better understanding of who is out there and available to us to ultimately help the patients. So even if it's a weekend, I can email our infectious disease nurse, and she will get back to me even if she's at home. I mean, she's a superstar in my eyes. And I have emailed Bonnie things, whether she's at work or not, just because that they're there. Had they not been at a staff meeting or shared some of their knowledge with us, it just gives us a glimpse into what the knowledge base that they actually have, and that they are such a tremendous resource for us. So it enables us to contact them and get whatever it is that we need to help us with our patients.
And I truly love to have nurses contact me. I've had several issues come up where they'll call me directly and say, can you come and just look this over and make sure I haven't missed anything? And they're just so focused on providing the best care possible. And it's awesome. They really take this role seriously, because you recognize the difference you can make for that patient, for their family. So I have no problem going over to the hospital and talking with the nurses and making sure that they have the orders they need. And it works out pretty well. And I think it's really a great advantage for the patients and the family too.
And I had a chance to be part of the cohort for Dr. Maria Williams' work for the role-based practice. And at first I was wondering, why am I in this training? Because, I've been out of practice for a very long time. But it made me realize that these are the types of nurses that we want to hire into City of Hope. So there was a question that we used to ask during the phone screen is, how do you see yourself as a role-based practice nurse? And we would probably get maybe 75% of the people that would respond, they wouldn't know what that is. But that 25%, they would talk about, I'm a scientist, a transfer of knowledge, and all of them would say, oh, I know this question, and then they would reiterate what it would be. And then those were the nurses that we hired, and they're still here today, and they're all making a huge difference. So pretty lucky to be trained in that. So anything else on role-based practice that you want to mention during trade chat? No? Okay, so we're gonna move along, and we are going to discuss holistic nursing. So what is holistic nursing?
Well, I like to just share what we view it as within my Department of Supportive Care. Really, it is just simply a way of not focusing on one point to recognize, like, say your patient is in pain. There's so many variables that go into that, and really not a whole lot of it is physical. And you have to really treat everything to effectively manage a patient's symptoms. You think about it, the opportunity we have here and how desperately our patients need our compassion and our understanding. They come in with a brand new diagnosis of cancer, and everything in their life is upside down. And just to take the time to treat them with respect and dignity, to be compassionate, to truly listen to them, is so nurturing, it's so comforting to them. They have so much going on in their lives. And I really try to get involved with helping the nurses because they do have to spend that time. If they put their light on that say they're in pain, they also have to pay attention to things like, hey, you didn't have any visitors today, or hey, you haven't been eating, or, and really research it and look at that whole person. And they can seek out additional help. At City of Hope, there is a social worker assigned to every oncologist. We have almost 30 social workers here, and they are a resource for nursing, because nurses could go to them and say, they shared with me they're really worried about finances, they're really worried about their children, and all of this feeds into their ability to heal, their ability to really challenge the cancer that they're fighting, and we'll get the appropriate people involved. And the way City of Hope has it lined up is you've got that social worker assigned, and the nurse can call that social worker, and that just starts a whole network of support that we have available. And you see that time and again, and nurses, I think, recognize that. It's an honor to care for these very courageous patients, but we also recognize that they need us, and we really try to make their stay here as comforting as possible. And that's probably the biggest thing I get in the clinic when I see them after their admission, is they'll go on about how they really felt like people cared here, and that it was such a difference than these larger facilities, because here they did not feel they were a number, they did not feel they were just a diagnosis, and that we really got involved with them. And I think that is so crucial to really addressing their medical issues, because you cannot separate that individual and their family from whatever that medical issue is and whatever support people that they have involved. And I think we do that here. I think it's fascinating. I've had people come and visit. Even a lot of our accreditation people will say, you only have to walk through the halls for 5 minutes and this is a different place. And it really is. It's there is something comforting, nurturing about it. I don't know if it's the way we have these gardens and landscapes where people can walk, and the fountains, but there's something peaceful and reassuring. And I think that's what I like about this hospital. We're big enough to do a lot of amazing things, but we're small enough to really recognize the individualized care that we need to provide. We've done some really amazing things. We had a chaplain here who wanted to celebrate that a patient was finally going to get to go home. He had a really complicated course, and she got everybody together to do what it goes with that mosh dance thing. And she just let everybody know at what time to be on the floor as they were wheeling them out. And there's just these little special things that we do, and it comes naturally. It's not pretend. And I think we recognize the honor it is to care for these patients too. So I that's one of the reasons that I truly enjoy what I do here, because I think that's such a crucial part of the care. And I think that's been impressed upon nursing here, that patients are so much more than their diagnosis. And it really is a pleasure for us to get to know them better. And my role, that's a must, because it impacts everything. You have to really look at them holistically to be of any help to them in their whole disease course.
I will share. I think as a young person, a student, the reason I came here initially was because I did my last clinical rotation at City of Hope with no idea whatsoever where I was going to work. I didn't know what I wanted to do. I just knew I didn't want to do OBGYN. I didn't want to hear the women screaming. Anyway, so what really got me was the Golter Gate. And even as a student, that was put in to my education here, was that we weren't really working on just the body, it was the soul. And it wasn't only that, it was also incorporating the entire family as a unit into our care. So we weren't only looking at the patient and how it affected them, because really, and what I tell a lot of the patients and family members on our unit when I'm admitting them, is that the patient can feel what they're feeling and they can give us nurses some direction, but the family members tend to neglect themselves because they feel like they're there to care for the patient as well. And they only focus on the patient, and they will neglect themselves. They won't eat for days. They'll forget to shower. They'll forget about the mail and stuff at home. And sometimes we'll just tell them, you know what? I'm good. I'm going to take care of, your loved one, whoever it happens to be, husband, wife, child, and tell them, I'm going to be here for them. Go take time for yourself today. Go eat food other than the hospital food. What they do here, they have yoga classes on certain days for people, for the caregivers as well as the patients. They have the Tai Chi, I think, is that what it's called? Yeah, Tai Chi for them. And they have other special things that they do. I think there was one day this year, right, where they had the makeup and everything done for them, for family members. So it's really nice. And then also, because we have the Hope Village and the patients on our unit tend to stay close to a month or longer, it's nice to get the patient's family members to know one another so they can go out and walk with each other. And it's just really the little things like that you do for them that makes me anyway feel better about giving that type of care, more of a holistic care with not only the patients but also the families and their children. And really what Bonnie expressed also, the social workers here are phenomenal because we can get them involved. When I've had patients' family members telling me that they were losing their home. They didn't have rides back and forth. I used to elicit my husband to drive family members back and forth to different places. So there's just so many things that we do here, and it's okay to do it. You're not held to, don't do that because they're going to expect it of me, because everybody has their own special thing that they do for the patients here. So it's nice.
Thank you.
Yeah, I agree with everything you guys said. I think it's so easy in a busy day of a bedside nurse to get so consumed with all of the tasks and the medications. And we have a lot of medications at City of Hope, especially with our transplant patients. And it's a very stressful time for the patients and for their families. And it's so easy just to see your patient and to never see the person. And to never realize that they have issues, not just here, but they may have issues at home. And they may have kids that are at home that they're stressed out about. How are they going to get to school? Or who's going to feed my pet? And, how am I going to pay for this huge expense? And they're, just trying to make it through the day sometimes just make it through the hour.
Right.
And it's so easy to get distracted with tasks as a nurse. And it's really important to step back and realize this is a person. And, how would you want to be treated if you were in the same place? And I think it's just a good place to sort of center yourself as a nurse on a regular basis to be, ask your question to yourself: how would I want to be treated? How would I want to be served? How would I want to be addressed? And to sort of get back to the roots of why you became a nurse. And it's not just about tasks, and those are important. But if we just throw medications at a patient, they're more than likely not going to heal unless we address their emotional needs and their spiritual needs. And, treating pain isn't just about giving them their next narcotic, but it may be something totally different that could distract them and take away the pain a lot better than even the narcotic could. And so I think that's, I think everyone has expressed that. That's what holistic nursing is. It's getting beyond the tasks, getting beyond, this is my patient in room 501, but this is a person that has a lot of really big needs. And what can I do to serve those? And thinking outside of the box, and getting away from your paper brain that I know a lot of nurses hold on to very dearly. And because our days, it's rerouted all day long with phone calls and physicians, and they're wanting to order what.
Right.
And so it's good just to keep that in the back of your mind all the time, that this is a person that has huge needs. In the City of Hope, the needs are really big.
Jennifer?
Yeah, I think it's really rewarding, like everyone has mentioned, to work in a place where this feeling of taking care of the whole patient, and that there's a lot of resources out there for the nurses and the patients themselves. So it's not just their medical problem, their physical problem, but that the nurses have the time and the resources and support to take care of the whole person. So I think coming here as a nurse, it's very rewarding, and it's almost a synergistic feeling to see everyone working towards that same goal. So I feel grateful that we have that here at City of Hope, and our ratios are lower than our state ratios for staffing. So I have a little more time to take care of that whole patient.
And the Poltergate that Mary was referring to is located on campus in Duarte, and it's in the Rose Garden. And it says, "There's no profit in carrying the body if in the process we destroy the soul." And I also remember when I first interviewed, Bridget Marshall went ahead and did my tour, and she actually took me straight to that Poltergate. And that said it all right there. And I said, this is where I want to work. And now that we are on the other side and we're recruiters, we would bring our candidates there, and that speaks to them a lot. So now, anything else you want to mention about holistic nursing, how it impacts
I think
patients?
holistic nursing also means that City of Hope is here for the nurses. I've had the pleasure of being contacted by managers to say an employee is having a difficult time at work because their father is in a hospital, and they have to make decisions about removing them off a ventilator, and they have a lot of questions because they just don't feel anyone's answering them. And it was really great how, I contacted some of the physicians in our group, and they were like, absolutely, let's sit down and let's help them. I've had people stop me in the hall and say, come on, let's sit down. And because, we have to take care of each other so that we can continue to provide the quality care for our patients and their families. And we have issues too. So it is this whole practice. And I love the fact that we recognize the importance to the soul, and that's really to nurture that sense of value and worth within all of us, patients, families, and the people that work here. And I think we really try to go out of our way to emphasize that.
So the third topic is evidence-based practice. So what is it?
So evidence-based practice is a problem-solving approach to healthcare that integrates one, scientific studies and patient care data, two, clinical expertise, all of us here in the room, and three, patient preferences and values. So it's really just using the evidence that's out there, the most current and best evidence to inform clinical decision-making. So it's something that's not, hasn't been ingrained in healthcare systems across the US yet, but there's a lot of movement towards making it more available to nurses, bringing the tools to nurses and supporting the nurses and mentoring them to utilize this and really implement what evidence is out there.
So how does that impact nurses on the unit?
Well, for nurses on the unit, I think there's a lot of practices. We term them sacred cows, which means it's something, yeah, it's an idiom. It's something that is above criticism because it's a long-held practice or belief or custom. So there's a lot of sacred cows in nursing just from tradition, but it's really having that state of clinical inquiry, like why are we doing this? Does the evidence support this? Is there a better way to do this? So I think when we start thinking about sacred cows and what we can eliminate through certain task-oriented procedures, we can really have more efficient workflow for nurses. And nurses, in utilizing evidence-based practice, can really empower their own practice. They can advance their own profession. They can work and collaborate with their colleagues and interprofessionally to advance nursing practice and improve patient outcomes.
Well, we have several questions from the audience, so anyone that would like to answer, please do so. How will the future of the nursing profession look like? And how will role-based practice evolve? The same question about holistic nursing and evidence-based practice. How will they evolve and what role will they play? That's a great question.
Well, I think that nursing is only going to get better. I think the future holds a great part for nursing, in that I think we're just going to continue to grow as a profession. I don't see nursing going away. I feel that we're only going to get stronger as a profession with healthcare changes and the expense of healthcare and the expensive insurances. I think that nurses hold a lot of key pieces to providing some of those answers and the resources. I think the biggest thing is that me being in a management position is to empower my nurses to make sure that their voice is heard and to make sure that if there's a decision about our profession, that nurses are at the table making the decision, and that we don't just hand it off to another profession to make our decisions for us, to say this is how nurses are going to practice. But if there are specific laws about our practice that we're making those, like Maria O'Rourke helped in the state of California, that we need to be strong in our voice, we need to be united as to what we do, and I think it's only going to get increase. I think our practice is only going to increase. I think the roles that are out there are only going to increase. I think it'll be interesting. I went from inpatient in the ICU to outpatient this summer, and it's a totally different world. And I keep hearing that the trend is going to outpatient because of cost. It's cheaper to keep patients out of the hospital. Patients do better outside of the hospital. And it'll be interesting to see how that really plays out. To see what I don't know what the landscape of nursing is going to look like, but I think the best is yet to come. I think that we're only getting stronger, and not just independent, but interdependent, so that we could actually be collaborating with our physicians and with the other people that help care for our patients, so that we can work better as a team also, I think is important.
I think the way nursing is going to change holistically is I'm going to hopefully be out of a job. Working in pain and palliative care, which is the more common title for what I do. What I provide is everything that you learned in school as a nurse, to treat your patient holistically, to address their symptom management needs, to get them the resources they need, to listen to them, to have them involved in planning of their care. And what I would hope is going to happen is all nurses will be really primary palliative care providers. that they'll have a good grasp of how to effectively pain manage, how to effectively troubleshoot, the importance of talking, the importance of treating them as individuals and being compassionate. And then what'll happen is it'll evolve more into a specialty for more advanced cases that maybe your patient isn't responding well to the current pain management. Maybe they still have more issues where the social worker will have to step in. So that basic care, I mean, there are some times, and I've read where palliative care individuals at other hospitals literally get consulted because the doctors don't want to order aspirin, or that they need someone to sit down and talk with them. And I really see the nurses stepping up with that as we work with them. And I think in the future, we have to be treating our patients holistically like we're trying to do here. And then palliative care, pain management would be more on an advanced level for individuals that don't respond to standard care. Right now, there isn't a standard care model throughout the country. I think we come close and we work collaboratively here, but I think in the future, it's got to be part of a nursing job of what I do.
Thank you.
You know what I'd like to also say regarding the role-based practice is that I think it's the National Institute of Health that would like 80% of nurses, right, a critical mass of nurses to actually be bachelor prepared. I think that's going to be a tremendous asset really in the nursing profession.
Right.
Personally, I'm an ADN prepared nurse. From some of the committees and stuff I've been on and work teams, the more knowledge I gained, the more I realized what I didn't know. So it caused me to go back to school to get my bachelor's, one more class.
Yay!
Yeah, I know, right? And it happens to be an under, 100 class. Anyway, but it really showed me in going back all the changes that are going on and really the change and the shift in the nursing paradigm. And I think a lot of what Bonnie said, I think ultimately maybe bachelor prepared nurses are going to be the new ADNs.
Right.
And really it's going to become more and more where you're going to find a lot of master prepared and doctorate in nursing. And I think that's nurses are going to function on an entirely different level eventually. I don't want to say taking over the role of the doctors because we do not have that knowledge that they have in the medicine, but we have it in our professional practice of nursing. And I think it's going to be utilized more and more, not only here at City of Hope, but really throughout the country and the world, actually.
Thank you, Mary. So another question is, can you tell a little more about how you educate your nurses about holistic nursing, role-based and evidence-based practice? Do you have any programs, classes? Do you offer any of those to nurses from outside City of Hope?
I can talk about evidence-based practice.
Okay.
We just started a few initiatives. We are holding, during our new hire orientation, we have an overview session on evidence-based practice and what it is and what models we use here at City of Hope. And then for new residents, we're starting to incorporate it and having them work through, I think about a 3 or 4 month project and recommending a practice change through a literature search and talking to their colleagues and seeing what other practices are out there. So we're starting to infuse EBP throughout different ways. And now with our new councils and work teams, we'll have a structure and a place, and we'll have time for nurses to really tell us how they best think that they should be educated and what sort of formal programs they would like on evidence-based practice. So we're just starting, but we're very excited.
You know what else is kind of nice is that really our in our staff meetings, not only in the staff meetings, but we have a bulletin board basically really, which gives us information. And so we can really look at how well we're doing as nurses regarding our age caps and our Prescani scores. And it shows benchmarks and it shows where we're at. So we can feel really good about the things we did. And then it gives us an opportunity really to make improvements and then go forward with figuring out what types of improvements we may want to make. And then really go back and do the data and find out if they even made any changes. And if not, what do we need to do to tweak them to then increase that score? So it's it's really empowering the nurses.
And the other question is, how can students and graduates get ready to work in an environment that embraces role-based and evidence-based practice? That's a good question.
Well, I think your nursing education, you've probably have had courses regarding evidence-based practice and role-based nursing. I think the biggest thing is just applying it, and I think that will come as you get your first nursing job, and hopefully you start at a place like City of Hope that engenders all of these important qualities of our profession, and that can support you in that. But I think at the end of the day, a lot of it is you have to make the decision on how you're going to practice, and you have to make it from level 0 before you start. You have to say to yourself, this is what my practice is going to look like. And I am a professional, and I want to continue to grow. I want to continue to stretch myself to be able to grow. And I think it's all a personal choice, no matter where you work in nursing, even if they're not allowing the role-based practice, you could still bring your ideas to the table, and you could change wherever you work, based on what your gifts are, your talents are, your beliefs. And so
I think also for a new nurse, a newly graduate nurse, is to come with a attitude of opportunity, really, and just a willingness to learn and to gain as much as you can when you're being precepted by whoever it is that's precepting you in whatever areas, and just pull from them as much knowledge as you can. Because to me, and this is what I tell people I precept, you know what, it's an opportunity really for you to take from me all you can get, because I'm willing to give it right now. I have the time. We're one-on-one, and I think it's just so wonderful to give some of the knowledge that we have. I was just training somebody the other day, and she was asking me, can you just tell me some of your little ways that you do things, differently, or how they're not really workaround things, but they're more effective ways of doing things, not necessarily taking shortcuts, but little things. How do you open this thing up if you don't have a scissors around, kind of thing? I mean, it's really simple things to do, but it saves you time, and it gives you an opportunity to spend more time with the patient. And also, I like, as a new grad, to get them involved with the patients when you're charting, since we do all our charting inside the patient's room, to actually chart and be able to converse with the patient. And you don't even really have to talk. You just have to listen. And it makes such a difference for the patients to be able to verbalize whatever it is that's going on with their day. And really, it gives you the advantage of, now, what can I do to help them in that aspect?
Thank you.
I also think, as a new nurse, when a fresh set of eyes and coming straight out of school, to not be afraid to ask your preceptor or anybody, why are we doing this? Mm-hmm. And to always maintain that spirit of inquiry and not be afraid, and just, for your own purposes, even your preceptor might not know something, and be an opportunity for both people to learn. Mm-hmm. And if there isn't anything that you can explain, to continue further and actually look into, is there any scientific evidence that supports that practice, and bring it a step further. Right. So never feel afraid to ask, why are we doing this? Right.
And the neat thing here also is that I want to say probably 3 years ago, we had new grads coming in, new cohort of nursing students coming through. And some of them wanted to join the UBC. And we opposed to having brand new people coming in, only because we didn't feel that they really understood how our unit functioned yet. But the more and more that what we did really was break down that wall. And we ask all the new grads now to come and join the work teams, maybe just at the unit base level initially. Mm-hmm. But they have so much knowledge that we don't have, really, with all the new things that they've learned. So
it's called the reverse mentor.
Yes.
Yeah, exactly. So it's nice. And they've seen different practices at different hospitals. And so definitely they can give us some information that, can be beneficial.
And the last question is, what are the challenges that nurses and units face while transitioning into evidence-based practice, and what advice do you have?
So So I think right now we're just starting to get our structure in place with shared governance and shared decision making. So having that time, that's a major barrier that's purported everywhere for nurses to look up research, to read journal articles, to reach out to other people. So it's a time. It's some people are resistant to change. So be able to go to your coworkers and say, hey, can you help me? And I saw this practice somewhere. What do you think about it here? And some people, when they hear change, they're fearful, right? They have to actively, change how they think about something. So I think just now that we're working towards having more set structures, we'll have more tools for nurses. So it's also having a lack of mentors and support. So we're trying to provide those so there are more opportunities. So there's a lot of work happening now, but I think in the future, in the next few months, there'll be a lot more opportunities.
Right. And with really what Jenny was saying is communication, I think is going to be the biggest thing in moving forward with it. Yeah, we need to continually communicate with everybody, with whatever we learn and get it back to whomever it needs to get to.
And create a safe environment for someone new coming in to say and want to make a change, to embrace that in a new person. So I think it's all about creating the environment first, getting the structures in place, a process, and then we can all, contribute.
Right. And then as one of the older people in this room, I'm
I'm
just going to say the other thing that the frightening thing is all the new technology.
Yes.
And just really not having a total understanding of it like, the younger people do.
Well, I think that's where younger people coming into the nursing profession have got to embrace. They're coming in with a skill where they are not the least bit intimidated by computers, and they're more likely to figure this stuff out. So they got to understand they're bringing some pretty great gifts in too. And it's a give and take kind of thing. And I think way back, when I was a new grad, the best advice I had is, get real. It's going to take you at least a year to be really functional, and you cannot expect yourself to be perfect. And you need to ask questions. You need to just be this sponge, and you need to get into situations where you're going to continue to learn and seek out the answers that you need. And all of us have been there. And I really hope, and I've seen it in the general environment here, the nurses remember what that was like. And they are by far much more nurturing, and you don't have situations like I had, where nurses would go out of their way and say, let's see how many I can get to cry this week, And I really think we've outgrown that, and I think it's a great time to be a nurse, and I think that you can really be nurtured here because we all kind of realize, just as I have to laugh, I'll be upset about something that happened at home, and then you walk down the hall and you see these patients, so brave walking with the white wristbands, or you go in and you see them in the rooms, and it really kind of makes your problems pretty small. Right. And I think we transfer that feeling throughout this institution, because we know how precious life is, and we know, but for the grace of God or luck or whatever you want to call it, we could be right there too. And why would you waste your energy being cruel and negative, when by far that compassion and understanding is what you really need to embrace? And I think we do here. I think that people that work here on every level, they do an amazing job, because boy, you've got a continuous reminder that you could be taking on a lot more challenges. And I think it's a humbling work environment to really keep you in check. And I do feel, and like I said, you can feel it in the halls, just how people interact. We know how precious life is, and you don't have time to be negative and to be angry or to not be helpful, because you know how important it is. So I think it's a great place to work, you guys.
Well, thank you so much. I know when me, Kayla, and Lavelle, when we bring candidates and we give them a tour and we bring them directly to the managers, we would talk with them afterwards. So how did it go? And wow, everyone is so nice and everyone is so kind. And you just feel this compassion, and just everyone really wants to help one another. And so that's the comments that we get even after the interview. Even sometimes we may not move forward with them, and sometimes we may, but that's something that they feel as well, and they're not even hired yet.
So that's a constant.
It is.
Yes, it's
It's a
a constant.
constant feeling.
Yes,
Mhm.
yes.
An environment.
So thank you so much, Bonnie, Mary,
Welcome.
Jason, Jennifer. And Kayla's going to go ahead, and she has a few announcements.
And speaking of how wonderful this place is to work, we're inviting you, inviting the experienced nurses. We have walk-in interviews every Thursday, and we're doing those until December the 17th. We're doing them on campus at the 1500 East Duarte Road in the city of Duarte in the Michael Amini building, first floor. You can park on Lot A. We have critical needs for outpatient and inpatient experienced oncology nurses, and also nurse practitioners and OR experienced nurses. Also, we will be at nurse.com career fair at the Pasadena Convention Center in Pasadena. It will be for November the 4th from 10 a.m. to 3 p.m. Come by and check us out. Our next tweet chat will be November 24th, same time, 3 p.m. standard time. And it's going to be on the latest in cancer research and treatment. So we invite you to check us out. And thank you for being with us today.
Thank you so much. Bye.
Nice.